The World Health Organization has warned of a global threat. 40 million children across the world have missed their vaccines against measles. As many as 25 million children missed their first dose, and as many as 14.7 million children missed their second dose. This decline undoubtedly is a significant setback. The WHO has been striving. The world has been working towards achieving and maintaining measles elimination. And the fact that children have not been able to take their vaccines leaves millions of them susceptible to infection. Probably this is what is playing out in India as well. In the financial capital of the country, Mumbai city, cases of measles are increasing. An 8-month-old baby died on the 22nd of November in a hospital. Though the autopsy report is still awaited, it is being looked at as a case of measles. The number of cases are mounting in Mumbai. Over 30 patients have been admitted to the city's civic hospital so far. 233 cases of measles were recorded at the time of filing this report. 12 patients have died this year already. So what are the symptoms of measles? The most common symptoms were rash and fever.
It can cause serious CNS complications like brain fever. It can cause bronchopneumonia, which can be life-threatening for the baby, and many other related complications related to malnutrition and the death of the baby.
Doctors say that children falling in the age group of 9 months to 5 years need to take an additional dose of measles and rubella vaccines. The center has asked the states to start the drive in vulnerable areas. Due to the pandemic, the anti-measles drive suffered. According to Maharashtra's Public Health Department, only 41% of children got vaccinated till October this year. The WHO has also pointed out this paradox, saying that because of the pandemic, the focus was on developing vaccines against COVID-19, and that's the reason why many other immunization programs have suffered.
Measles infection is a viral infection. It belongs to the paramyxo group of viruses called as Viridae. It is perhaps one of the most contagious and the most infectious childhood illnesses. It is airborne and can be transmitted through personal contact. It involves mainly the children less than the age group of 5. Classically, it follows in 3 phases. To the susceptible, you have a phase which is a prodrome phase for about 10 to 12 days, then an infectious phase which has a fever for about 4 or 5 days, followed by a rash, which is typically a flat reddish macular rash which begins from the head, face, neck, nape of the neck going downwards. And then the fading of the rash goes exactly the same way opposite from down to top. It is often followed by and associated with loose motions, occasional vomiting, ear infections, bronchitis, pneumonias about 6 to 8%, and rarely even meningitis or meningoencephalitis.
No region of the World Health Organization has either eliminated or sustained measles eradication. Since 2016, 10 countries that had previously eliminated measles experienced outbreaks and re-established transmission.
For more informative videos like this, keep watching India Today News Mo.